you see that the discharge is thin, and then we have a dirty fishy smell.
Okay.
Particularly after sex.
Okay.
Yes.
So what you mean, it comes from the imbalance between the good bacteria, the bacteria as you have mentioned it.
Yes, please.
And also this comes after someone having sex with their partner.
Well, bacterial vaginosis is not an STI. It's not a sexually transmitted infection.
Okay.
Yes. However, sexual activity is a risk factor to have this condition.
Okay.
That's why we see that the majority of women who have this condition are between age of 15 to 45, and that's the reproductive age, and that's when we have that's the age group where you have this condition mainly.
Okay.
It is very difficult to find it in people who are not sexually active. However, it's not a sexually transmitted disease. Okay.
So, doctor, how common is this condition among women? So maybe you give us the epidemiology of how far it has reached till today.
Well, the bacterial vaginosis, we see that globally about 30% of all women within the reproductive age have this condition.
Oh, okay.
Yes, in every 100 women, you find that 30 have bacterial vaginosis.
Okay.
And when you come to Africa, you see that the rate's actually higher
than other countries.
Yes.
Oh my God.
Some studies actually have shown that the prevalence can go as high as 60%.
Okay.
Yes. And in Uganda, we see that studies are not so different from the general Africa. They're around the 50%.
Okay.
20 to 50%. The range can differ from one area to another. You find that in rural areas, the prevalence may be higher because of the poverty. People don't seek healthcare early and all that. Yes.
Okay, so doctor, are we increasing, like from what you have said, from the past 5 years, has it decreased or it is increasing like per day?
Yeah, bacterial vaginosis is increasing because of so many risk factors which are also increased. Yes, as we will see later, we see that perfumed soaps, douching are some of the risk factors, and these are on rise.
Okay.
People are marketing them, V-wash, what, and the things which are accelerating the increase of this condition.
Okay, so doctor, from right there, can you explain to us what causes it and how does it develop? How can a person start developing bacterial vaginosis?
As we said in the introduction, or in the definition, we have an imbalance. Our body has billions and billions of bacteria.
Okay. From
the mouth, from the skin, the vagina, and the intestines, there are billions of bacteria which are good to our body. Yes. Actually, they help us to fight some diseases, and others also help us in other body processes.
Okay.
But now, when you have an imbalance of the good bacteria and the bad, this bacterial vaginosis arises.
Okay.
And that's the hallmark of developing this condition.
Yes.
However, the risk factors, we have douching. Do you know douching?
No, explain a bit more, cause.
Okay. So douching usually, that's when a woman uses a lot of water or mixed with some soap or water, and then they put it deep into the vagina, usually in the clinic.
Okay.
So that practice erodes or disrupts that equilibrium or the balance of the good bacteria and the bad. So the good bacteria we have in the vagina is called lactobacillus.
Okay.
It makes the pH of the vagina to be acidic, so that these harmful bacteria can't grow there.
Yes.
Yes. Now, usually the common bad bacteria is called Gardnerella.
Okay.
Yes. That's how usually becomes the bad in that area and creates that imbalance. But usually when we have the equilibrium or the balance, this lactobacillus help us to kill the bad one, and then we have the equilibrium, and there will be no bacterial vaginosis.
Okay.
Then the sexual activity is a risk factor.
Okay.
We see that many women develop bacterial vaginosis after having a new partner, or those in multiple sexual partners.
Okay.
Yes. And then also bacterial vaginosis can increase the risk of having getting an STI, because we've already seen that by fact that you have bacterial vaginosis, there is an imbalance.
Oh, that comes with it.
Yes, and remember the other lactobacillus makes the pH of the vagina acidic, and that acidity help to prevent the growth of the bad bacteria.
Yes.
Now someone can get gonorrhea, can get HIV, can get chlamydia, all those STI, because you've reduced or you've weakened the natural defense of the acidity in the vagina because of bacterial vaginosis.
Okay, so you talked about someone getting a new partner and something like that. So does it mean it can be carried from one person to another? Or it's...
Not really. It's not sexually transmitted. That was clear initially.
Okay.
It's an imbalance. But the new partner or the multiple sexual partners increase the risk of someone to develop this.
To develop it, okay.
Yes.
Okay, so doctor, let's continue from there. What are some of the common symptoms a woman should look for when they are to see that, you know, starting to get vaginal vaginosis, yes.
Okay, so we talked about the fishy smell, particularly after sex.
Okay.
Yeah, I think even a man can tell, because fishy smells a bit weird.
Okay.
Especially when you've not eaten it. So if you smell that fishy odor after sex, most likely it could be having bacterial vaginosis.
Okay. So that means it's immediately after you can feel this fishy smell.
Yes, even during sex.
Okay, even after, like after a person having sex, like for 2 days, you can still feel that fishy smell.
It's usually immediate, because now someone's going to bathe or going to wash herself, then the smell may go, but usually it's immediate.
Okay, so that means when it comes to 2 days after, that's not a bacterial vaginosis, that's something else.
It can be bacterial vaginosis, but for it is characteristic in that that odor smell is so strong after sex. Then also during menses, during menstrual periods, that fishy smell can be present. Another symptom, we may have the discharge, which I talked about.
Okay.
The discharge, I said, is thin. And then after being thin, it can be of any color. It can be white, it can be gray, it can be yellowish, it can be green. Okay. But it's thin.
Thin, okay.
Which is different from other discharges, which are usually thick.
Okay.
Yes. Then another thing, you may have painful micturition or dysuria. That's when someone feels pain when she's urinating. Yes. Though also that can be due to other diseases
related with it.
Yes.
Okay.
Some can also experience some mild itching.
Okay.
Mild, but usually the intense itching occurs in vaginal candidiasis.
Okay. So can someone have it without seeing those symptoms?
Exactly. About 50%
of the people
of women with bacterial vaginosis are asymptomatic. They don't show any symptom.
But when they have it?
When they have it. Okay. That's why it is always very important to go to a nearest hospital and the doctor checks you. Don't wait when you have the fishy smell.
So it's necessary for a person to check because it doesn't show symptoms most of the time?
Yes.
Okay.
Yeah.
So what are some of the major risk factors that increases the chances of getting it?
Yeah, we talked about the douching. I remember explaining it to you.
Okay.
Yes. When you use a lot of water mixed with soap, then you put them high in the vagina, it erodes. Vagina is one of the organs which are self-cleansing.
Okay.
You don't need to do a lot of cleaning, otherwise it's going to cause an imbalance of the good and the bad bacteria.
Yes.
Then perfumed soaps or detergents. You know, you can't fight a smell by applying a perfume. That's why people use That's why people use air fresheners to make their room smell good. When they have not actually taken out what's making the room smell bad.
Okay.
So applying those perfume soaps, others using vaginal deodorants, the V-wash and all that, are some of the things which destabilizes the equilibrium or the balance of the good and the bad bacteria. And it's a risk factor. Risk factor is not a cause. Risk factor, it's something which increases the likelihood of
getting something. Okay. Doctor, we see that most of these V-washes are sometimes recommended, like they have been accepted by the drug authority and they are on market and people are buying them, like, and you're saying that they disrupt the pH. So what's your take on that?
Well, you've seen people smoking.
Yes.
Even when the cigarette packet has pictures of these lungs, which are cancerous.
Yes.
You've seen those pictures,
of course,
or the packets.
Yes.
But you've also seen people smoking.
Yes. Okay. Yeah, I can tell by that.
Yes. So there are so many harmful things on the market, but it's you, the person, get the information and actually take heed of it.
Okay.
Yes. Otherwise, this is authentic information. Perfumed soaps, the vaginal deodorants and all that increases the risk. Of course, there are those who may use them and they don't get it. But studies have shown that it is a risk factor.
Okay. So, doctor, how does, you talked about sexual activity, how does it play a role in bacterial vaginosis, and how can someone get bacterial vaginosis through sexual activity? Well,
we see that now when you have a new partner or when you have multiple sexual partners, they may have other bacteria. Then also you look at for example, someone may have gonorrhea.
Okay.
Have sex with you. They have another bacteria brings it to you. And then if you also have all the other risk factors like the itching, the risks or the likelihood increases.
Okay.
But bacterial vaginosis is not a sexually transmitted disease.
Okay, so you talked about douching and all that. So this comes to hygiene.
Yes.
So how does hygiene play a role into getting bacterial vaginosis? Or this is just a misconception, something people like talking about?
Just use soap, water, and maybe normal soap, not the perfumed one, to clean themselves. You don't need to get bacterial soap, because there is antibacterial soap,
yes,
which is medicated, perfumed soap. All those do increase the risk of developing this condition.
Okay.
Yes. So there's nothing like the other one is unhygienic or the other one is not. It's all about the balance of the bad and the good bacteria. So
we've seen that many parents when they're having babies, most especially those people who are staying in rural areas, like when a baby is playing and they're washing, immediately after they finish, they'll put the baby in the basin and then they wash them. What's your take on that? Because like many people don't know about this information.
Actually, bacterial vaginosis is very rare in people who are not sexually active.
Okay.
That's why we said the prevalence is highest between the age of 15 to 45.
Okay.
That's the age, the reproductive age, and that's when people have
it.
sex. Yes.
Okay, so it's not something that can come immediately after it.
Yes.
Okay, so doctor, many women think that this infection is a sign of being unclean. What's your take on that? Is it harmful or it's just a myth?
The bacterial vaginas being harmful or being unclean?
Okay, no, they think it's a sign of being unclean.
That's not.
Yeah.
Actually, using those perfume soaps
Okay.
is a risk factor.
Okay.
We use them in your vagina. Yes. So it may not necessarily mean that someone is unclean. Yes. So that's why we need to go to the hospital and get a treatment.
Okay.
Yes.
So you said it is not an STI, but then it affects that part. So is that misunderstood, or why is it not called a sexually transmitted disease?
A sexually transmitted disease or infection is that one which is transmitted through sex. Just as those words are. If something is not transmitted through sex, then it is not, just as I said.
Okay, so it's...
Because we've seen that there is no bacteria which comes from the other partner to the other to cause bacterial vaginosis.
Yeah, sure.
We just have the imbalance.
Okay.
Yes, that's why it's not an STI. However, someone can have an STI with bacterial vaginosis.
It can happen at the same time?
Yes.
Okay.
That's why when you come to the hospital, they take off a vaginal swab, that discharge, and they examine it to find which bacteria is causing the problem.
Okay, so this is a very important discussion and something we are learning from. But before we go any further, let's take a short break and then we come back. And Dr. Kagwa Henry is here in studio with us answering our questions. So doctor, from where we had stopped from, we had seen what bacterial vaginosis is. So in continuation, let's go straight to how it is diagnosed in the hospitals.
Okay, well, if someone is suspected of having a bacterial vaginosis, we in the hospital will examine them.
Okay.
You may have to look at their vagina, it's the discharge. You may take off a swab, which is examined in laboratory.
Okay.
To confirm that the person has the bacterial vaginosis. Then we can choose the treatment for them.
Okay. So what is the proper treatment that is given, and how long does it take?
Well, the treatment may be tailored to the patient according to the symptoms they have. Some may have allergies to some other medicine. So it's not a one size fits all.
Okay.
Yes. So after the confirmation of the diagnosis, the doctor will choose which appropriate treatment is for the patient. They usually give antibiotics.
Okay.
Yes.
So, doctor, many women practice vaginal steaming. They say that it improves their reproductive health. So, medically, is this safe?
Well, sorry. About the steaming, I've not seen someone doing it. I also hear like you that people steam. I don't know what they put in that water. Yeah, but unless maybe water can burn their genitalia if the steam is too hot. Okay. And then maybe also we may have disruption of the imbalance as well. Okay. Because if the temperatures are high, you may kill off some bacteria, yes, which is good. So I think we need to do more studies about this, because I'm also a researcher. We may need to go further and find out what happens during vaginal steaming, because we don't recommend it in the hospital that you go and steam your vagina to treat anything. Okay. Yes, has not been recommended anyway. Okay. So also we have seen that many women nowadays, instead of going to the hospitals to get treatment, you talked about the treatment is given according to how the person is affected. So we find that many women they go to the clinics and they buy antibiotics to treat themselves. What do you talk about that? Actually, thank you for this opportunity. Let me tell Ugandans, pharmacies are not medical centers or hospitals. Okay. Pharmacies are meant to dispense medicines to patients on doctors' instructions. Okay. So the tendency of going to the pharmacy and say, hey, I have headache, I have cough, give me this medicine. It's not right. That's self-medication. And actually, overuse of antibiotics is one of the risk factors that can lead to bacterial vaginosis, because the antibiotics will kill some of the good bacteria, fueling the bacterial vaginosis. Okay. So self-medication is very, very bad. Of course, when you go to someone's pharmacy with money and you want a medicine, they'll sell you the medicine, including strong antibiotics. Okay. But this does not happen in developed countries. To get an antibiotic, you must have a prescription from a doctor. So meaning this is a thing that is just common in Uganda? Yes, but it's wrong. You know, thing can be common or seen as normal, but when actually it's wrong. We're seeing what we call antimicrobial resistance. Yes. Where we find that some medicines are no longer effective in treating certain conditions, including malaria. Okay. Because this has been due to overuse, some use when they don't need them, and all that. Okay. So, doctor, we have seen the treatment part of it, but let's go straight to the complications that may arise. What happens if a person is not treated with this bacterial vaginosis? Well, if someone is not treated for bacterial vaginosis, some of the bad bacteria may ascend may go higher from the vagina to the uterus, the tubes, and cause what we call pelvic inflammatory disease.
Okay, so that comes from there. The pelvic inflammatory disease comes from bacterial vaginosis.
Not per se, but as I said,
Yes.
it can be a complication from bacterial vaginosis, because we've seen that now you've reduced the strength, the natural acidity of the vagina because of the imbalance. You can get more and more harmful bacteria which can ascend and cause that pelvic inflammatory disease as a complication, which started from bacterial vaginosis.
Also, doctor, can this BV affect women's fertility?
Of course, if now someone has gotten PID, the pelvic inflammatory disease, their fertility may be affected.
Okay, so it is a major risk factor.
Yes, so that's why it's important, if you have any symptom, any discharge, to go to the nearest hospital and get examined, then you get proper treatment for it.
Okay, so can it also be dangerous women is pregnant?
Yes, actually, there's some increased risk of miscarriage.
Okay, due to that.
Due to bacterial vaginosis, yeah.
Okay, so does BV affect like a woman's daily life, day to day?
Of course, now we talked about...
If it is ignored, you know.
We talked about the fishy smell after sex. Now, you may lose your partner because of the fishy smell. If you have painful micturition, you can't urinate properly. To affect you in one way or the other.
Okay.
Yes.
Is there any complication you would like to share with us that may come from this bacterial vaginosis, if at all it's not treated?
Well, majorly the PID, pelvic inflammatory disease, may arise from bacterial vaginosis.
Okay.
Yes, so it's important that when you have symptoms, which you talked about earlier, it's important you go to the hospital, get tested and get treatment before such complications arises.
Okay, so doctor, let's go straight to the prevention part of it. So what are some of the daily habits a lady there watching us can do in order to prevent themselves from getting BV?
Well, our dear mothers, they should use water
Okay.
to clean themselves, and maybe this normal soap, normal bathing soap, not the scented one.
Okay.
Yeah, because the vagina has its natural smell. Now, for you, don't create your own smell. If the smell is not pleasant, it means
there's something
wrong. You have to visit a doctor.
Okay.
Another thing, it's important to have one sexual partner, because we saw it's a risk factor for bacterial vaginosis. Be faithful to your partner.
Yeah.
And this in the long run also help you to prevent other diseases which are sexually transmitted. Then when you go to have maybe sex with a new partner, even if you tested for HIV, it's important that you use a condom. Yes. Then I think don't self-medicate, and given antibiotics, compete them, because we have chances of recurrence. Usually after 6 months, this condition may reoccur.
Okay,
so it's important when you're given treatment in the hospital, you
take it. Yes.
Then it is also very important that you eat health foods to keep your immunity strong. Okay. Because this will help you to ward off the harmful bacteria.
Yes.
Then other things you need to ensure that you don't do douching.
Okay.
About douching.
Okay. Yeah.
Yes. So when you do some of the things, you can prevent bacterial vaginosis. Okay,
so doctor, as we are going in for the cause from our dear viewers, from your experience, what is some of the common mistake ladies do regarding to bacterial vaginosis that can bring up that when it's something that can be prevented? And
Yeah, some self-medicate. You know, usually before someone comes to the hospital, they first ask their friends, their mother. I used the other cream, it helped. I used the other insertion, the pesa, it helped me. So they first go through that cycle. When all that fail,
Okay.
that's when they come to the hospital. Some, not all. Yeah, so it's important that you come to hospital. You get to know what's really the problem, and you be given proper treatment and ensure that you complete it.
Okay.
Yes. So maybe another thing I've seen with women, soap, scented soap.
Scented soap is a problem.
Yes. Please don't force a good smell, because putting a perfume where there's something rotten,
Okay.
you're not treating. You're just treating a symptom.
The symptom.
Usually those scents spend about 12 to 24 hours. The scent will go away and the bad smell will come back. So it's important to treat the cause of the problem rather than using these quick fixes of perfumed soaps and the like.
Okay, so thank you very much, Doctor, for all that wonderful insights. To our listeners and our viewers watching us, this is your time to call in and ask your questions. If you have ever experienced the symptoms or have any questions about bacterial vaginosis, Dr. Kagwa Henry is here in studio with us and is going to be answering all your questions. Call us on that number that is up there on your screen. We are going to be picking in calls, and feel free to ask and also send messages. We are going to be able to answer them because we have an expert doctor right here with us who is going to be talking to us and answering our questions. Doctor, as we are waiting for the questions, is there any one thing you would like to tell our dear viewers watching us today, like your last take on bacterial vaginosis?
Well, bacterial vaginosis is treatable.
Okay.
It is curable. So there's no reason why a woman should wait for complications before coming to the hospital.
Okay.
So it is very important when you have any symptom, anything which may not be, which have not been seen. For example, discharge. Every woman has a normal discharge.
Yes.
So if you see something unusual, it's important that you come to, or you go to a nearby hospital and get her checked. Then treatment will be offered to you, and you'll be well.
Okay.
Yeah, so you should be the first doctor to your health, because you're the one who sees the discharge, you're the one who may feel
the discomfort, the odor,
the dirty fishy smell, fishy odor, which is pungent, offensive. Don't get used to it.
Yes.
Come and
get treatment. Okay, so let's pick a call here. The person has gone off. Also, our dear viewers, as we had said, call now. Doctor is here. He's going to be answering your calls. TV1, hello.
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 Yes. What's your name and where are you coming from? Plus, if you have any question, if you've ever experienced, Dr. Kagwa is here with us to answer your questions.
Hello.
Hello.
Is it TV1?
Yes, this is TV1.
I would like to ask the doctor, because I have some infection. I would like to know, to advise.
Advise on what exactly?
Doctor.
Yes, please.
On diseases, about the skin diseases.
Pardon? About the...
Thank you for the skin diseases.
Okay, thank you very much, and thank you for calling and I think we've had your question. So let's pick in another call coming in. This is TV1, and there is a call line there. You can call on that one, and we are going to be answering questions. And Dr. Kagwa, as I had said, is here to answer your questions. Let's pick up this one. TV1, hello.
Is here to answer your questions. Let's pick up this one. TV1, hello.
Can you leave your TV, and then you can ask. Hello. Hello.
Hello.
Yes. Your name and your question.
Good evening.
Good evening.
I would like.
Okay, thank you for calling in, though it didn't pass through, but thank you for calling in, Doctor. As we are winding up our program, please send greetings to 1 or 2 people watching you, and also let's pick up this one last call, then we get straight into that. TV1, hello.
Hello.
Yes. Your name and your question, and where are you coming from? Hello.
My name is Dr. Henry.
Nyabo. Nyabo. It's okay, you can speak. Dr. Kagwa is here. Agenda kuba addamu ekibuuzo kyo.
Boyfriend wange.
Yes.
Ofuna obulumi.
Ofuna obulumi. Okay.
Simanyi oba nabaki simanyi kale.
Kale.
Ngenda kubbi. Nitandika okudevelopinga amabwa.
Okay. Okay.
Simanyi oba kizibu ki.
What's her name?
Dr. Kagwa is going to answer that. Nenga webale nnyo kuba webale ddala. Abalabi bafa balungi mwebale nnyo kuba Dr. Kagwa. Let's get back into it. Someone has asked that question, and we are going to answer it after this one last call, and then we go straight into it. TV1, hello.
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 I'm Latif calling from Entebbe.
Yes.
Thank you for the program.
You're welcome. And thank you for watching. So what is your question? Yes, stable.
Doctor, chekireetera omuntu kubalakasa okubanga waddugala nga tewakala.
Kale Doctor agenda kuba addamu ekibuuzo kyo, naye nga webale kunakubeera ng'otaddeko ate ng'otulaba. Kale sebo. Doctor, you had the questions.
Yes.
So let's get back into it.
Well, I didn't get the names for the callers.
Yes.
Yeah, but there's a lady who asked about postcoital pain, pain after sexual intercourse.
Yes.
Yeah. So I think she needs to visit a nearby hospital. Yeah, clearly that's abnormal to feel pain after sex. It's not normal. So she needs to visit a nearby health facility to diagnose and to get proper treatment. It's not normal to feel pain during sex or after sex.
Yeah, sure.
Yes.
Okay, so there is only also one last question that was asked.
Yeah, someone talked about the Malakaso. I think I can answer in Uganda because
it's okay.
they're still Uganda.
Yes.
According for Entebbe. So if agambye nti mu Mbalakaso balabi bamanyi Embalakaso. So Embalakaso wakati w'ebisambi bweyambuka eno waggulu bwe wati. tuyita embalako sagali batera obeera nga waddugalira ng'ate tewakala. So tulina obulwadde tuyita tinea cruris. It's a fungal disease which usually affects that region. Usually batera okubala nga asiibwa nga tewajjako n'ebikalakampa sometimes. Fungi zikula nnyo awantu awali damp. So omwami oyo yamukubiza agende ku ddwaliro erimu okumpi afune obujjanjabi. Ate n'ekirala alabe nti bw'aba amaze okunaaba yeesiimuula bulungi n'akaala. Ate bw'amala n'ayisayo eddakiika nga 3 ate nayambala ngoye za munda.
Toyanza nnyo toyanze. Doctor, thank you very much. Please send greetings to 1 or 2 people and then we can call it a day.
Well, thank you for hosting me here at TV1. I send my greetings to my mom, Scovia. She's there in Kasanda. I don't know whether she's watching me or not. Maybe she is. Yeah, most likely. Thank you. So our dear viewers, we've seen that silence and misinformation should never stand in your way of good health, and understanding your body is the first step of protecting it. And if something feels wrong, speak up, seek help and action. And thank you for tuning in. This has been your health show. And there are many programs that are coming in. Stay tuned, because TV1, as our tagline says, see the difference. We always bring up programs that make you see the difference and tell you don't change any station. Stay on this one, because we are bringing in more and more good information. Thank you for tuning in. Stay safe.